안녕하세요, 지오맘입니다. 제가 저번 영상을 봤더니 벌써 그 영상을 올린 지가 2개월이 지났더라고요. 그래서 이제 2개월 동안에 지오의 그 TMS 치료에 대해서 업데이트된 부분이 있습니다. 일단 지오는 TMS가 아니라 뇌파로 TMS 치료를 하는 그 MERT, 멀트 쪽으로 방향을 완전히 돌렸고요. 그것이 이제 첫 번째 소식입니다. 그리고 두 번째는 그 멀트 치료를 하는 곳이 BTC라는 곳인데, BTC가 여러 분점들이 있어요. 지오는 미국의 달라스 지점에 올해 8월부터 6주간의 치료를 하기로 예약을 끝낸 상태입니다. 이게 두 번째 소식입니다. 2달을 있을 예정이라 이제 6주에다가 저희가 이제 두바이에서 미국으로 이동하는 시간도 있고, 이제 여러 가지로 한 2달 정도 저희가 이제 살 집을 제가 예약한 건 아니고 저랑 이제 친한 언니가 또 예약을 했어요. 저는 참 운이 좋게도 이렇게 계획이 어떻게 착착 맞아 떨어져서 치료를 받게 됐습니다. 멀트에 대해서 제가 이제는 보통 어느 정도까지의 그 자료를 이해하고 이 치료가 어떤 효과가 있으며 뭐 이런 것들이 지금 정보들이 뒤죽박죽이 돼 있었어요. 그래서 제가 이거를 정리를 해서 어떻게 여러분들한테 알려드려야 하는데 정리가 도저히 안 되는 거예요. 너무 많은 정보들이 여기저기 흩어져 있어서 제가 이걸 어떻게 정리를 해야 할지 엄두가 나지 않았는데, 이 MERT 멀트 예약을 하면서 그 받은 이메일에 유튜브 영상이 있더라고요. 그래서 제가 사실은 이제 지오 뭐 학기가 또 이제 시작되고, 제가 그 뭐 선생님들과 미팅도 있었고, 또 제 직업이 또 굉장히 바빠지면서 이거를 비디오를 볼 시간이 없었는데, 제가 요번에 비디오를 30분간 경청을 했어요. 열심히 봤는데 거기에 제가 여기저기 흩어져 있던 정보들이 한 방에 그 비디오에 있는 거예요. 번역을 했죠. 아직까지 그 한국어로 번역된 영상들이 많이 없고, 물론 이 치료를 하고자 하시는 분들도 국내에서 자료를 좀 찾아보시려면 한계가 있지 않을까, 이런 생각이 좀 들더라고요. 그래서 또 아주 부족하지만 제가 또 그 번역을 했습니다. 저는 원어민이 절대 아니고요. 한국말을 아주 잘합니다. 당연히 이제 한국어가 저는 이제 제 그 모국어이기 때문에 오히려 영어를 한국어로 번역할 때 말이 잘 되게 번역을 하는 것 같아요. 그 맥락을 알아보시는 데는 아무 문제가 없으실 거라고 생각을 합니다. 이 비디오는 그 닥터스라는 TV 쇼예요. 그래서 이 TV 쇼에서 멀트 치료에 대해서 어떻게 보면 소개를 하는 그런 영상입니다. 이 영상 안에 제가 이제 여러분들에게 전달하고자 했던 이 멀트 핵심 부분들이 다 들어가 있어요. 그래서 이 멀트 치료를 관심 있어 하시거나 또 이 치료 계획을 세우고 계시는 분들은 이 자료를 꼭 보셨으면 좋겠어요.
An autism diagnosis can be devastating. And for one single mom, it has affected every single aspect of her life. And our show realizes that every child with autism presents differently, and how you treat them and how they progress, it's different. So on our show, we're always thinking about new possibilities. And I want to introduce everyone to someone in our audience, Dr. Spencer Miller, because Dr. Miller, can you tell us a little bit about a unique treatment that you offer that may have some hope, and certainly for a mom like Leah who feels out of options? And it's called MERT.
Right.
Can you tell me what that is and how it works?
Yes, so MERT is an emerging technology. It is experimental in some regards that actually tries to reprogram abnormal electrical signals in the brain. We measure the electrical signals using a quantitative EEG, so it's a very simple, common use practice in neurology, where we put a cap on the head and look at where abnormal signals are coming from. We then turn around with that data and use these electrical signals to send back in the brain and try to attempt to re-attenuate or to modulate these brain signals. And the changes that we measure on these repeated EEGs should correlate to behavioral changes.
And the child looked very comfortable, didn't look like there was any pain associated with the procedure at all.
Non-invasive, no medication involved with it, no pain. Sometimes you can feel a little bit of an electrical pulse, but it's a mild tap on the forehead.
How many treatments typically do you need to administer, and how soon do you see results, and what have the results been?
Usually within the first couple of days or weeks, you can start to see some benefits, some changes in their behavior. In general, we recommend about 4 weeks to 6 weeks of treatment. The treatments are every day, 30 minutes or so. So they come to the clinic, get the stimulation, and go about their daily business. So some children will have significant behavioral changes very early. Some will take longer to get results. You know, this is all new. And like I said, it's kind of evolving over time.
In your experience, what kind of results are you getting in terms of the number of kids who are showing a benefit, a change in behavior? Do you have a number or percentage?
So I don't have a percentage with me, but for the patients that I have seen changes in behavior, it's typically just exactly what you're asking for. Language in general is one of those things that seems to really be commonly changed. The way that they interact with their environment, their ability to change from, you know, we have to go to a doctor's appointment at 7 today instead of 8, so we're gonna have to change our schedule so there's not a meltdown in your car trying to go to a doctor's appointment. The other thing that we hear a lot of parents talk about is the presence, which, you know, is not really a medical term, but you know what I'm talking about. If your child is not there with you, even though they're sitting right in front of you, you're talking to them, there's just this absence. And so to be able to feel like your child is with you and listening or understanding you, so we hear parents describe those type of behavioral improvements.
And what potential side effects do you discuss with patients when you're talking about this procedure?
So the one that is the most feared really is not that big of a deal. However, we have to discuss it. It's about a 1 in 150,000 chance of having a seizure. It's self-limited. A seizure is abnormal signals of the brain. We're reprogramming the brain, so you can imagine that that's a potential. But the seizure that would occur would be self-limited. You stop the stimulation, the seizure goes away. And I don't know of any cases where treatment has been administered and caused a seizure that then results in epilepsy or the epilepsy syndrome, where you have continuous seizures throughout your life. So I don't know of that to be the case.
So to me, really exciting. Acknowledging, however, that it is still experimental. And right now we have clinical neuroscientist Dr. Lindsay Oberman joining us today via Skype to weigh in. And you've heard our discussion, and I think you're also well aware of how frustrating it can be for parents trying to find anything that might help. What's your take, as we've been discussing this, in terms of treating autism with MERT, and where do you stand on the issue?
So I've been using TMS and other brain stimulation tools. MERT is a form of TMS, transcranial magnetic stimulation. I've been doing this for about 15 years. And in the individuals with autism, both adults and children. And TMS and MERT uses a very large magnetic field, where we know that magnetic field can modulate brain networks and brain circuits. The question remains as to what brain circuit do we want to modulate, and in what way that will lead to a positive change in terms of behaviors. So we want to be improving language. We want to be improving things like reducing the meltdowns or improving social interaction or presence, as he mentioned. But what types of protocols with types of brain stimulation do we need to put in to do that is still unknown. So the concern as a research field that we have is that there's only been one single, very small scale clinical trial in individuals with autism. It was adults, in fact, that showed very small improvements over a placebo control condition where there was no magnetic field at all. And so the concern we have is that there's just not this scientific evidence base out yet. The FDA has not approved it. It hasn't even been submitted to the FDA because the trials have just simply not been conducted. So we are hoping that those types of trials can be done and will be done. But until then, we are just simply not recommending that it be used clinically.
And I know it's still experimental and you're still learning, but just based on the experiences you've had, is there a way to tell which autistic children are more likely to respond to treatment?
No, so there are metrics that are trying to be identified, whether it be EEG or MRI or other brain-based metrics, to try to say this person will be most likely a responder to TMS or drugs or behavioral therapy across a number of disorders, depression, anxiety, other disorders as well. And that metric has, again, unfortunately not been identified as of yet.
Wow, sure seems like it's worth a try to me. And that's why I want to ask both you, Lindsay, and also Dr. Miller, how do you go about making that decision? Because what would be the downside to trying it if, as Leigh has attested, you know, nothing else has really helped Noam get to the place you would like him to get to? So I'll open the floor for your comments on that.
So the downside would be no benefit at all the time you would pour into something like this type of a treatment. Again, 6 weeks, 4 to 6 weeks every day. You know, the downside would really be that there is no effect, which we do have children that have gone through 4 to 6 weeks and get no effect or no change in their behavior. What's interesting to note, though, is that we do have research that currently shows that there are specific EEG changes in a autistic brain. And it's not a new tool by any means, but we're starting to understand how, by utilizing EEG to analyze autistic patients, how it can actually help us understand what's going on in the brain. Because we don't know what causes it. You know, we don't really have a cure for it. None of these type of treatments that we're talking about really are FDA approved. They're all off-label. You know, it's important to understand that. However, like you say, there's really no
Can I ask two questions? How much would it cost, for instance, for a 4 to 6 week treatment cycle?
Somewhere around $10,000.
Which is, yeah. and that's an important question to ask, because
clinic, you know, so.
The cost is always a downside, right?
Absolutely.
If you get no benefit and you pay for something, that's a downside.
You feel like a terrible person when you know, after somebody has done that treatment and you're, you know, wow, I appreciate what you've been through, but that's a lot of money to say, hey, sorry, it didn't work, you know.
And then I'll bring you back in, Lindsay. It seems to me that a good clinical trial would answer a lot of these questions. Is there one happening? How close are we to maybe being able to say, this is the right protocol, this is how it should be done nationally, if you're going to try this?
Yes, so 2 things. I do not want to give the impression that I don't think this is promising, because I've been doing it myself for about 15 years. I do believe in it. I believe that we can, I know we can modulate the brain using TMS to improve functioning of various circuitry. That being said, it's not simply that it may not work, but we may modulate it in a way that makes things worse. And this is, as a researcher, as a parent myself, what I would worry most about. When we talk about risks, yes, there's a very small risk of inducing a seizure, 1 in thousands. However, a bigger risk is that we are shifting the functioning of a brain, especially in a child, a developing brain, that we don't know exactly where it is at this current moment. You certainly can do an EEG, but EEGs change millisecond to millisecond. It is not a simple static state that a person stays in for days or months in an EEG. So we can measure this, but there isn't the data out there that we can confidently say, I know what protocol that may help you. And there is a potential downside, is that I may modulate your brain in a way that may not be positive, that may actually lead to impairments or a greater symptom in a certain domain, because I'm not sure which way to modulate which part of the brain.
Lindsay, let me ask you this, and then we have to take a break. If we've been providing these treatments for 15 years, my curiosity is, how come we don't have any trials? That is really frustrating for me.
It is.
Dr. Mill, where are we in terms of getting some really good data so that maybe a few years from now, we can say, this is the treatment protocol, and this is what you should do. And if that doesn't work, then this.
I mean, are you gathering data with your treatment of the patients you're doing?
We keep a data set. You know, every single day that the patients come in, the parents will describe symptoms. We can follow the CARS score, which is the Childhood Autism Rating Scale, things like that. But one of the limitations, exactly what you're saying, the limitations is that we don't even have a unified way of measuring what autism is, right? It's a spectrum that doesn't really even have a cause that we know yet. And so that is one limitation. What we would have to probably do is focus more on behavior or symptoms that we're trying to modify and move from there into a clinical trial, and then eventually evolve into, well, when your child has this behavioral change, this is the protocol for it, or this is how we attenuate it. MERT is a little different in a sense also, even a variation to that, in the sense that we're not really treating a brain disorder. We're treating what we see on the EEG. In other words, we're re-attenuating the abnormalities we see regardless of what the diagnosis is. And so it's a unique type of treatment approach.
Autism spectrum disorder is complicated and doesn't have a simple answer. But some say there is hope on the horizon with an electromagnetic therapy called MERT. Joining us now in our audience is Miriam, whose daughter went through this treatment. And I'm gonna go ahead and ask you, Miriam, a little bit about your daughter's autism.
Of course. Well, when she was a baby, everything seemed perfect. You know, I was able to take her to the mall in a stroller. We were able to go everywhere. But as time passed, she was around 1.5 years, everything went downhill, everything. Starting with her lack of connection to me as her mother or to anybody in the family. And one day, I remember specifically, I went up to her, I said, Raquel, and she ignored me. And then I said, Raquel, and she wouldn't turn around and look at me. And then I started screaming her name, right behind her ear, and she didn't even flinch. So I thought, she deaf? It's the first thing I thought. So I took her to the doctor the next day, and the doctor took a metal pan and threw her on the ground, and she flipped, she got scared. And he goes, congratulations, your kid's not deaf. And I said, well, if she's not deaf, what is she? What do I do? Well, I don't know. So from there, she stopped making eye contact. And I have twins, so it was very easy to compare at that age. One was doing so many things. You know, one started saying words. You know, Marcela, which is my twin, she wanted to be with me. She wanted to hug me, love me. Raquel couldn't stand my touch. She was always gone in her own little world. And as time passed, it became worse. It was like a jail that she was trapped into. So no visual contact. She wasn't listening to her name. She wasn't following instructions. Her sister started speaking. She stopped speaking. There was nothing about her that was normal. So as time went on, things got worse because she stopped going out of the house. We couldn't take her out anymore. And so when she was a baby, she was able to go out. And when she was around 3 years old, I took her to a mall, and she screamed so much and cried so much that a gentleman asked me if she needed an ambulance. So we're not talking about like a tantrum. We're talking about full-on blown panic attacks. It almost felt like she was being attacked by the world. I didn't know how to help her, so I just didn't take her out anymore. And when I did want to just be a little stubborn and say, I want a normal day with my family and I want to take her out, she would bite herself because she was so frustrated. Also, you know, by now, she's what, 4.5 years old, she's still wearing a diaper. Our family was in so much pain. And like many moms like Leah, we do so much. I have a list this long of everything I tried, and she wasn't budging.
How old was she when she was formally diagnosed?
She was formally diagnosed when she was 1.5 years with severe autism. Okay. I was told she would have to be put in a hospital eventually because, you know, she was having a hard time. And so you were trying everything. Nothing was really helping. I want to ask you when you found out about this treatment we've been talking about called MERT. Well, okay, so she was 4.5, and I went to see a doctor in Atlanta, Georgia, and he said, listen, Miriam, you know, we've been working together for 3 years. You've done everything I've asked you to do. I can't lie to you. Your kid isn't getting better. Why don't you try this at the Brain Treatment Center? This thing's called MERT. He sort of explained to me what it was. And I just took the airplane. I just went. I wasn't even done with the conversation. I was already at the center. So I show up, and they tell me what they're going to do. They're going to do an EEG on my daughter and tell me, you know, get a glimpse of how her brain's functioning. And I have to say, that day alone, for me, it changed my life. Because you go to so many doctors with your autistic child, you don't have many answers. There's not much research out there, like you said, you pointed out. They were able to tell me who my daughter was. they were able to tell me about her attacks, her anxiety, why she wasn't speaking. It's just, I got answers for the first time just about her brain. You know, not even about anything that had to do with her diagnosis. Here's your kid's brain. And it just felt so good to have that validation that, okay, I'm not crazy. This is not normal, you know? What happened after Mert, it just changed our lives.
Miriam, what changes did you see in your daughter after Mert?
At 4.5 years old, I was gonna throw in the towel. I was tired, I was frustrated, but we did the first day of treatment. I didn't see any change the first day. The second day of treatment, it was amazing. So the first thing we noticed was she was able to go in the car and not cry, which, just so you have an idea, we hadn't taken her out of the house unless it was for medical appointments for over 1.5 years. So when we're in the car and we stayed an hour away from the center, we were able to take her, and she didn't cry or hurt herself or scream. And I remember holding my breath. I'm like, oh my God, I'm looking at my husband. He's like, don't talk, just in case you startle her. Like, it was like, oh my God, is this really happening? So when we get there, my child walks up to the stairs. She goes, sits in the little chair she sat the day before, and she grabbed this, the coil that they use, and she put it on her head. She liked it. And she was able to stand that whole therapy session with other kids screaming or other parents walking around, phone calls, things that before she wasn't able to stand. So I said, okay, I'm staying no matter what, because to me, it was the first time my daughter was comfortable in her skin in many, many years. So that day we went back to where we were staying, and she came up to me. I was in the kitchen with my husband, and she came up to me with a little cup, and she said to me, dame más jugo, give me more juice. And those were the first words I had ever heard from my daughters.
Miriam, I want to just take a moment, because those were her first words.
First words.
And in my mind's eye, those aren't your first words unless you've been wanting to talk.
Yes.
And
Yes.
you know what you want to say, but you cannot say
She knew the
it.
words.
Yes,
And that's important for people watching. And I mean, for you as a mother, where then did she go after that point forward?
So a week later, another thing changed my life, right? So this is life-altering for me. A week later, my daughter finds out I'm her mother. Just like you're hearing it. She comes up to me and she says, upa, like that's our word for up. Right? So I carry her, and I'm like, oh my God, she's letting me touch her. And my daughter grabs my shoulders, and she parts me like this, and she shakes, and she goes, ah! And then she hugs me. And then she parts my shoulders once again, and she goes, ah! And then she kisses me. And I remember this day because it was the happiest day of my whole life. And my aunt said, oh my God, it looks like she's just getting to know you. For the first time, like, she's just getting to know me. She's born today. She knows I'm her mother today. And from that day on, she likes my heels. She likes my dresses. She likes my makeup. She's just a mama's girl now, as to before she had no idea.
But let me say something else. She wasn't born that day. She was born when she was born. All
You're right.
through the process, she knew she was loved. And so I want to say that to any parent out there who is in a situation that you were in. There's hope, right? And your story attests to that. And we actually even have some video of Raquel before and after her treatment. Met Miriam, whose daughter has tried Mert. Here's some video of Raquel before and after the treatment.
Y la cabeza, abre la cabeza. Enséñame la cabeza. ¿Dónde está? A ver, ¿dónde está? ¿Dónde está la cabeza? ¿Dónde está? ¿Dónde está?
Ven, di, Marcelita, Marcelita.
Marcelita.
Papá, te amo.
Papá, te amo.
And, I mean, Miriam, it's like a miracle. I mean, it really is. I get chills seeing that. Does she just continue to get better, or?
She did. She did. So after we were almost done with the month, I told my husband, I want to go to Disney. He goes, you crazy? I'm like, we did the mall. You're happy. She's happy in the mall. We did the park. She's happy in the park. I said, I want to go to Disney. I need to go to Disney. Like, I need to know that my daughter can be in the happiest place ever, and with all the sensory information that she couldn't stand before because she couldn't handle anything. And so we went to Disney, and she rode the carousel and she enjoyed it. And her family felt whole for the first time. And she has gotten so much better because now she's 11, all right? And so my daughter goes to a regular school. She's above her class in math. She made her first friend this year. To me, that is like, it's a miracle on its own, you know? She can go anywhere with us. You know, she loves airplanes. If I'm leaving, she's like, I'm coming with you, right? You know, she's part of her family. And yes, you know, my daughter is autistic. She'll always be autistic, but I am proud of that. My dream is her independence and her be able to say, this is who I am, and I'll be so proud that she can do that. Her speech still needs catching up to, you know? She's 11, she started her first words at 4.5, but she can definitely do so much more now than she did before. She's able to like, let's say I went on a trip, that same day I decided to leave, and she was like, wait, you're leaving all of a sudden, is everything okay? For her to be able to understand these things, like, I never thought possible.
And I wanted to go back to you, Leah, because you've been listening to this story, and you earlier said one of your greatest hopes is that you could just hear Noam say a word.
Miriam joins us now. Miriam, so nice to see you again.
Hey, Miriam.
You too. Thank you for having me.
So tell us, how's your daughter doing today?
Every year since then, she has continued to progress in such a beautiful way. And today, she's 13 years old. She goes to a regular school. You know, she's just like any other teenager now. Yeah. We continue to use Mert as a great, great backup. You know, as a parent, when I see that she's plateauing or she needs that extra push, I oftentimes go back to the clinic and do an EEG and take a look and see, okay, is she ready for another frequency push? Is she ready for, and sometimes she is, sometimes she isn't. But we have had that amazing technology all these years, and I couldn't be more thankful.
Now, in the spirit of full transparency, Miriam, you now work for the company that offers Mert to autistic children. Is that right?
Oh, yeah. Oh, yeah. There was just no way I was going to let that company go after I saw what my kid could do with it, you know? Yeah. So, yeah, now I dedicate my life to helping other parents with this technology and an empathetic ear.
이 비디오에 나오는 그 의사 선생님, 그 신경 전문의가 또 어떻게 우연히도 그 달라스 BTC 지점에서 그 진료를 보시는 그 닥터 밀러 의사분이시더라고요. 그래서 지호가 그분에게 직접적으로 치료를 받게 됩니다. 그래서 제가 그 영상을 보면서 저분이구나. 그래서 굉장히 반가웠던, 네. 참고로 BTC는 분점이에요. 이 프로토콜을 보내주는 연구소가 딱 한 군데래요. 캘리포니아에 있는 그 연구소에서 이 전 세계 지점의 BTC 그 진료를 받는 아이들의 프로토콜을 이 한 군데에서 다 보내준다고 합니다. 분점마다. 그래서 어느 분점을 가시더라도 똑같은 프로토콜을 받으신다고 해요. 그래서 결정을 하실 때 BTC 어느 분점을 가겠다 결정을 하실 때 특별하게 그렇게 막 고민을 안 하셔도 저는 될 것 같습니다. 어차피 BTC는 똑같은 프로토콜을 받기 때문에 사실 의료진이 그렇게 큰 의미는 없을 것 같습니다. 그래서 자신이 지금 살고 있는 그 지역과 그리고 또 여행 경비라든가 이런 거 잘 생각을 하셔서 가장 그 합리적으로 현실적인 곳을 선택하시면 결국 똑같은 치료를 받으시니까 크게 고민은 안 하셔도 될 것 같아요. 이 부분을 제가 이번 영상에서 다루지 않는다면 다음 영상에서 어떻게 예약을 했으며 경비라던가 이런 부분에 대해서 제가 조금 더 정밀하게 다뤄볼까 이런 생각을 지금은 하고 있습니다. 멀트치료는 가격이 다 동일해요. 정확하게는 만불 6주를 기준으로 할 경우에 6주를 가장 기본적인 치료의 그 기간으로 잡더라고요. 그래서 6주 치료를 기준으로 봤을 때 보통 그 처음에 받는 그 뇌파 검사 이런 비용까지 다 합쳐서 12,000불에서 뭐 14,000불 요 사이니까 1,000만 원이 훨씬 넘는 가격입니다. 가격이 굉장히 사악하죠. 네, 저한테는 굉장히 큰 돈입니다. 그래서 저도 뭐 이제 어쩔 수 없죠. 이 예약도 끝났고 했으니까 저는 이제 쭉 가는 수밖에 없습니다. 이 영상을 보시고 현실적인 그 멀트의 그 치료 후 아이의 그 뭐라 그랬죠? 치료 효과, 그리고 비용, 그리고 지리적으로 한국에 살 경우에는 미국이나 뭐 호주 이런 다른 쪽으로 나가야 하는 뭐 이런 여행 경비 문제 이런 거 좀 잘 따져보시고 현명한 선택을 하셨으면 좋겠고요. 지호가 멀트 치료를 한다고 해서 저는 모든 아이가 이 멀트 치료를 해야 한다 이거를 이 비디오에서 말씀드리는 거는 절대 아닙니다. 우선 가격도 굉장히 사악하고요. 저같이 평범한 사람에게는 굉장히 큰 돈입니다. 가격도 사악하고 또 굉장히 이게 새로운 치료를 해가지고 아이들마다 이 치료 효과가 다 달라요. 그래서 그 정도의 돈을 들여서 이 정도의 효과를 본다. 글쎄요. 멀트를 또 여기까지 알아보니까 제가 이거를 포기할 수는 없더라고요. 뭐 되든 안 되든 한번 가봐야겠다. 저도 또 이런 생각이 또 들어서 또 제 마음도 벌써 비행기를 타고 사실은 멀트 치료를 받으러 갔어요. 제 마음은. 그래서 제가 이런 결정을 내렸고 이 영상을 보시는 부모님들은 또 다른 생각을 하실 수도 있을 거라고 생각합니다. 이 모두의 의견이 다를 수 있고 모두의 결심이 다를 수도 있기 때문에 이 영상을 보시면서 아이에게 잘 맞는, 그리고 현재 자기의 상황이나 이런 데 잘 맞는 그런 가성비라고도 하죠. 똑같은 돈을 들여서 사실 이 치료보다는 이게 더 낫다 이런 분이 계시다면 그쪽으로 완전히 방향을 트셔도 될 것 같아요. 이 자폐라는 세계가 이것만이 정답이라는 게 아직까지는 없잖아요. 지호도 사실 생리학 치료도 하고 있고 식단도 하고 있고 영양제도 엄청 때려 먹이고 있고 ABA도 하고 있고 뭐 다 하고 있죠. 저는 어떤 신념을 가지고 있는 사람이냐면, 신념이라기보다는 어떤 스타일의 엄마냐면 다 해보자. 뭐 내가 후회하지 않기 위해서. 사실은 엄마가 나중에 후회를 할 것 같아서 저는 다 해보자 이런 주의이기 때문에 이것까지 하는 겁니다. 그래서 이 MERT 멀티에 대해서 회의적인 그 시선을 갖고 계시는 분이 사실 그 쇼에도 나와요. 네, 충분히 인정합니다. 그래서 이 영상도 그냥 여러 세라피를 하는 엄마의 뭐 어떤 참조 영상 이 정도로만 가볍게 봐주시면 감사하고요. 또 이 영상이 그 닥터스란 TV쇼를 제가 그대로 따왔기 때문에 저작권에 걸려서 또 이게 뭐 사라질지도 모르고요. 뭐 저작권에 걸렸다고 뭐 비디오가 블락되거나 하진 않더라고요. 그래서 비디오는 계속 남아있을 거라고 생각을 합니다. 어쨌든 지금 여러 자폐에 대한 연구와 새로운 치료법들이 이렇게 나오고 있는데 저는 개인적으로 너무 감사드려요. 언젠가는 자폐도 빠른 시간 내에 hopefully 빨리 정복되기를 바라고 우리 아이들이 이 인생의 즐거움과 경험들을 어떤 감각적인 장애라든가 뭐 이런 여러 가지 이슈들로 모든 아이들이 즐길 수 있는 즐거움을 못 느끼는 이런 슬픈 일이 일어나지 않았으면 좋겠어요. 이제 그런 의미에서 빨리 자폐가 정복되기를 개인적으로 굉장히 바라고 있습니다. 네, 궁금하신 것은 언제든지 제 댓글장에 남겨주시고요. 번역한 부분에서 오류가 발견되면 또 따끔하게 저에게 일침을 한번 날려주시기 바랍니다. 네, 오늘도 감사드립니다.